Hey, let's welcome Dr. David Klein of the Stages of Life Medical Center in Orlando, or Medical Institute, if you will, to the airwaves right here at the Rob Newton Resource Hour. And Dr. Klein, there's a lot of people right now talking about sore throats and strep and earaches for all of our kids.
Well, here's how it works. It's fall. Even here in Florida, we do have a change in the season, okay? Although you may not notice it. But certain things happen whether the temperature drops below freezing or not, and one of which is seasonal allergy, another of which is seasonal infectious disease. And what seems to cause a great deal of irritation, a great deal of consternation, and a great deal of absenteeism are these very troublesome sore throats. Okay, so somebody ends up with a sore throat, they feel a little bit crummy, and the first thing that they think is that they may have strep throat. Well, strep is a very specific, a very particular infection, and has very interesting consequences, either in the kidneys or elsewhere in the body. So when somebody comes down with strep throat, we tend to treat it rather aggressively with such arcane and expensive medications as penicillin or amoxicillin, two of which are given away just about for free at your local pharmacy. Well, all sore throats are not strep, and all strep isn't a sore throat. And so one of the things that we have to look at is what are the symptoms, what are the complaints, and how does the patient present? You can walk around as a strep carrier. Okay, that's why we go ahead and we do these swabs to people in the hospitals, especially the hospital staff, to make sure that they're not inadvertently giving it to the patients or the visitors in the hospital. Happens all the time. You walk around, you're Typhoid Mary. You're the person that's carrying the disorder without any obvious symptoms. You're giving it to everybody else, just free of charge, if you get my drift. It might be the only free thing that you get at the hospital these days. They gotta love these hospitals. They're a good place to go die. Okay, so what is your sore throat all about? What's the differential diagnosis? Well, strep throat actually is one of the rare ones that people actually get. But these viral illnesses are far more prevalent, and then there's things called cell wall deficient organisms that will cause such things as sore throat associated with earache. So first thing the doctor needs to ask the patient is, one, are you able to swallow? Okay, and that's a very important question. You may be able to swallow, it might hurt, but if you can't swallow, an astute observer, a physician that has some experience, the first thing that they're going to consider are those disorders that could potentially cost you your life. And epiglottitis is one of them. Okay, inflammation, infection of the epiglottis, which is this little flap in the back of your throat. You never see this thing unless you're peering down somebody with a scope. When it becomes infected, okay, it can actually obstruct and kill. People die from this every year. So the first thing the doctor should ask is, are you able to swallow? Or they'll sit back and watch you swallow. If you're able to swallow and you do it without your eyes glaring out, or if you're not drooling for that matter, then odds are you don't have this ailment. But once a doctor's seen it once or twice, they'll never forget it. Especially in children, where they'll sit up with their chin forward. It's in a position that's sometimes called, sniffing the morning, dew or whatever. You're out there with your nose forward, trying to straighten out the throat so you can breathe at all. And this is one of the things that you see shortly before the patient goes into full obstruction. It's a bad thing when this occurs. So strep throat needs to be treated with antibiotics. Epiglottitis needs to be treated by going to the hospital immediately. But there are many more things in between. Okay, there are many other causes of sore throat that one has to consider. Mycoplasma is one of my favorites. If you had to pick an infectious disease, that's one of my favorites. Why? Because it causes a knife-like earache. People come in, sore throat, they can't really drink, they can't eat very comfortably, but their ears will drive them nuts. So how does the doctor, how does the technician, how does the paramedical individual actually make this diagnosis? Well, they'll go ahead and they can draw a drop of blood. That'll help a little bit. A swab will tell you the diagnosis in 3 or 4 days. Okay, but one of the more interesting things you can do is examine the patient. You examine them for lymph nodes, enlarged lymph nodes. These are filters that the body has that suck up the poisons that are being drained from these infected areas. They enlarge and they become annoying. If they're under the angle of the mandible, strep throat is the most likely possibility. If they're under the chin, you can about guarantee it. But if they're in the back of the neck, it's more than likely going to be viral. And that's why the doc spends his time or her time feeling your throat, feeling your neck, because the location of the glands is a clue as to what the nature of the illness is. And most of these glands will appear in the posterior portion of the neck, suggesting that they're viral in nature. Well, what else can cause sore throat and absenteeism? Well, how about just your basic, simple sinusitis? So if you have sinuses that are draining, and they have to drain one way or the other. One way is out the front, but the other way is out the back, and it's called post-nasal drip. This too will lead to a sore throat. So you need to consider sinusitis, whether it's infectious. You look at the patient, you look at your friend, you look at your family, and if they have an asymmetric appearance to their face, and nobody has a purely symmetric appearance, by the way, but if they have a swelling over the area under the eye, maxillary sinusitis is very, very likely. One side, one eye pain, one ear pain, sore throat on one side. You really have to consider maxillary sinusitis. Far less frequently, frontal sinusitis, which is over the eye, but it can occur. Well, what else can cause sore throat? And this is one of my more favorite things, is inflammatory thyroid disease. So
Really?
somebody comes in with a thyroid flare. Now, when you have autoimmune thyroid disease or any other autoimmune disorder for that matter, it tends to flare 2 times of the year, very much more prevalently in the fall and in the spring. Now, why this is, I don't know. I'd love it if somebody could come up with a real measurable explanation for this. I used to believe it had to do with temperature changes. You know, when the temperature starts to fluctuate wildly, people have a tendency to come down with a higher incidence of infectious disease and autoimmune disorders, to include thyroiditis. So we've had a number of folks coming in with hot thyroids with sore throat. Okay, and how do you treat that? You settle the thyroid down. The thyroiditis eases and the pain goes away. So we can use topical anti-inflammatories, oddly enough, for this, and you'll know whether this is going to work in about 60 seconds. Very, very fast. What about bronchitis? Okay, well, let's think this one through. Bronchitis will cause sore throat because of the coughing involved. So you end up with a mechanical sore throat. So you have to talk your way through the patient. You have to talk your way through the diagnosis in order to figure out what to properly do. Or what happens is you start throwing antibiotics at people willy-nilly. The question then comes up, well, isn't it cheaper just to give somebody an antibiotic and get them the heck out of the office? That's a really good sign of a technician, not a physician, but a technician. What are they interested in? Getting you out quickly, doing as little damage as possible, but maybe not helping you very much. What do antibiotics do that could be such a drag on your system? Well, the first thing that's helpful to recognize is that the difference between an antibiotic and a cancer chemotherapeutic agent is something called mammalian tissue specificity, that is. Okay, so what are we talking about? An antibiotic is an antibiotic only if it kills bacteria, preferentially to mammalian cells. Now, what does that mean? It means that they kill them more than they kill you. Okay. In other words, there is some tissue toxicity. And if you don't believe that, look up the tetracyclines, the erythromycins. They have tremendous renal toxicity, liver toxicity, and neurotoxicity, ototoxicity. Why is this? Because they are not entirely specific for bacteria. So when you take them, you better need them. Taking them willy-nilly doesn't help anybody out. Now, whatever became of the old probiotics? Well, gee, if we give you antibiotics, that's marvelous because it's going to help your system. But then the doctors don't follow through. Well, gee, we'd better replenish the good bugs that are protecting you from the environment. And they don't do that either. So they're killing you 2 ways from Sunday. So when you end up with a sore throat, if you're not knocking up a fever over 100, 101, odds of you having a bacterial illness needing an antibiotic is very, very small. What about viral illnesses causing sore throat?
Sure.
Okay, herpes simplex will do it. Okay, extraordinarily common issue. You end up with a herpes sore in your mouth, or an aphthous ulcer for that matter, and you'll end up with a sore throat. It is a viral illness, and taking antibiotics does absolutely no good at all.
We may need to make this one a little bit longer than 10 minutes. I'll tell you why. What about kids and earaches? And when did this whole thing happen along my 62 years that in my generation I'd never heard of the ear tubes? But all of a sudden just kind of blew up in the 80s, and every kid had to have an ear tubes.
Okay,
what's that all about?
Insurance reimbursement. Okay.
Oh.
Yeah, forgot all about that. Okay, a PE tube, takes about 30 to 60 seconds to put in. And they used to reimburse very, very handsomely. So the ENT docs would go ahead and they'd pop these things in. They might do 10, 12, 15 patients before lunch at $1,000 a pop. Okay, now they might get paid $80. So you don't see them happen quite as frequently as you once
There
did.
you go.
But what is a PE tube? Okay, a PE tube is a little polyethylene piece of plastic. It looks like a mushroom, okay, with a hole in the center. And what you did was you took this piece of steel, surgical steel with a sharp edge on one end, and it was bent ever so slightly. You looked in the ear, you poked it through the eardrum, allowing whatever pus might have been in there. And it's always a speculation whether it actually had any pus in it, because if there were, it would be so small you wouldn't be able to see it. But I don't know, you made a sucking sound with the aspirator, and then you put one of these little plugs in. And then they sat around and fell out on their own. And then the kids would end up with another sore throat, and you do it all over again, and you'd end up putting your kids through college. So when I was when I was a general surgeon, when I used to do that kind of work, we used to call it ears, nose, and tennis. They'd come in, they'd knock these things out, and do a round of golf or tennis in the afternoon. But in any event, be that as it may, the PE tubes is a real issue. Does it cause any problems? The surgery itself does not. But what's interesting right now is that they're finding brain damage in children that undergo general anesthesia. This data is very recent, like within the past 6 months.
Wow.
So unnecessary anesthesia in infants, children, and whatnot is going to cause damage. Now, I'm boarded as an anesthesiologist. Okay, and I'll tell you, when you go ahead and you knock somebody unconscious, it doesn't do them any good. Okay, and how long does it take to bounce back from a general anesthetic? It may take you 3 or 4 days to a week or more, and you'll see cognitive issues for much longer than that. When you're dealing with children with immature central nervous system condition, in other words, they're immature, okay, they're growing beasts, okay, the last thing that you really want to do is to do unnecessary general anesthetics. We used to do them all the time. I think it's a very bad idea. What about those tonsillectomies that were so common when we were kids?
Oh, yeah.
Well, they found out something very interesting. They weren't put there by mistake. Those tonsils were not a mistake of nature, okay? They actually protected you from the environment. Go figure. You know, nature didn't make another mistake that we were trying to correct by lopping them out. So what do you do when you have a sore throat? Do what I do when I have a sore throat. One, I tough it out. The second thing is I go to a very expensive high-tech product called Chloraseptic, which is 1% phenol. You spray that stuff in there, suck on the little lozenges. You'll get by that 12 to 24 hours of discomfort. After all, get over it. We're not a nation of pussies anymore now, are we? Now, what do you do about the infection itself? Colostrum capsules. Not the liquid at the hippie store, but the capsules. What this is it gives your body a shot of gamma globulin so you can fight the infection. Licorice root extract. What does this do? Glyceric acid is an antiviral. You can take these things with flip ability without, and you're not going to be doing any damage whatsoever. Echinacea and golden seal. These things kick up your immune system. And then the one that seems to get forgotten is ginger. Ginger and ginger root, which is a NK beta antagonist. This stuff is marvelous with regards to inflammation as well as hepatitis and a number of other things. But for general inflammation, especially when it's acute, this is a grand cocktail. Do you need curcumin? Not for this necessarily, although it isn't going to hurt you.
There you go, folks. Always like to give the doctor as much time as he needs because this is serious stuff. And Robin, we need the stages of life.
Yes, we do. Our phone number is 407-679-3337, and our website is stagesoflife.net. We're open Monday through Thursday, 8 to 5. The health store is open during those office hours. We invite you to come on in, and also check us out on Facebook at Stages of Life Medical Institute. Life Medical Institute. Life